How many months that you do the research on which one the technique that you plan for, just like from the PPV on the standard technique from the colon?
I've been researching the two different methods for about a year and a half, 2 years for now. At first, I was leaning more towards the PPV method, but after doing more research, I understood that I did not have enough donor tissue to get the depth that I was hoping to achieve out of this.
The depth can be achieved a lot from the colon compared to the PPV. In our system, hybrid PPV, that means you have the skin graft and skin, part of skin and urethra in the front, and then the end of that one is peritoneum. So you can get benefit from 2 inches from peritoneum. But that's it, that you can get that one because we cannot get more than that.
Is recovery easier for PPV than colon?
Something that good for PPV that you need not to have the problem of the colon when you go to toilet. It's just the same one that you have before. But when for to go to colon, you need to go to toilet quite often, 2 or 3 times a day at the first 2 or 3 months. And after that, you get after your body adapt to your short colon, it's really good.
My name is Mona, and I'm here with Danny and Dr. Thirupong. So I have decided to get the colon vaginoplasty method. Has been here for a month.
Yeah, I had peritoneal pull-through.
By laparoscopic. Actually, we do laparoscopic for PPV. Like the colon we have both open and laparoscopic. But you pick up laparoscopic, right?
I picked the laparoscopic, yes. Less scarring was my hope.
How many years that or how many months that you do the research on which one the technique that you plan for, just like from the PPV on the standard technique or from the colon?
I've been researching the two different methods for about a year and a half, 2 years for now. At first, I was leaning more towards the PPV method, but after doing more research, I understood that I did not have enough donor tissue to get the depth that I was hoping to achieve out of this. But I was curious, what are some more key differences between the two methods?
For the PPV and the colon, for the PPV, you need not to cut the colon out. So it's a benefit that you need not to just after surgery, you need not to have any problem on the colon, because after the colon surgery, you go to toilet quite often for 2 or 3 months after your body adapt to it.
I think I have small bladder anyway.
So you have just a short bowel, just a short colon, the colon shorter. So don't have the residual for to get your food that's going down to the rectum. So it's just quite going to the toilet quite often. But for the PPV, you do nothing on the rectum. So it just get there from the peritoneum. So that one is different from that one, but the depth can be achieved a lot from the colon compared to the PPV. PPV we do this in our system right now. We still just definitely do the hybrid PPV. That means you have the skin graft and skin part of skin and urethra in the front, and then at the end of that one is peritoneum. So you can get benefit from 2 inches from peritoneum. But that's it, that you can get that one because we cannot get more than that because it's just
More depth because it's hybrid.
it's hybrid. We get more depth than the standard technique. But actually the benefit is not to cut the colon now. But the depth is just can get the 2 inches compared to colon. You can get a little more, just like 4 or 5 inches. But actually, it's just like the colon, it's just need for someone that really problem, just like your case, have circumcised, right?
Yes.
And the short penis and just scrotum skin is just really short. But for the colon, can get benefit from the more range of the vagina.
Colon can be more high maintenance, can't it?
High lubricant.
Like you have to look after it more and
Yep, you need time to take care of yourself more than just the PPV. But the difference with the aftercare of the colon and PPV, the colon can really easy to get the good depth when you do dilation.
Yeah.
But for the PPV, you need to do the dilation strictly in the schedule to do.
you need to be more on it with dilation and
You have to do dilation more than colon because it just can have some problem on the contraction of the peritoneum after surgery more than colon. But actually, the benefit is just you need not to cut the colon.
So with colon, is dilating easier?
Actually, it's easier compared to the PPV. If you the open technique of the colon is and something, and the second one is the open colon, the laparoscopic colon, and something is very hard to do dilation is the PPV. But you can achieve that one already.
So my recovery was quite fast, is it?
The recovery is very good. There's good recovery. Then the external appearance is very good too. And just the shape outside, it's just swelling on the labia minora for just a bit longer times. So I do 2 or 3 months. After that, it's very good. After 3 months, the swelling will go down a lot. But for the inside, it's very good for your case. You have the good, still have the good depth of that part of the PPV.
As long as I maintain dilating well. So the recovery, is it generally easier for PPV than colon to recover?
Say that again, please.
Is recovery easier for PPV than colon?
Something that good for PPV that you need not to have the problem of the colon. When you go to poo or you go to toilet, it's just the same one that you have before.
Yeah.
But when for to go to colon, you need to go to toilet quite often, 2 or 3 times a day at the first 2 or 3 months. And after that, after your body adapt to your short colon, it's really good. For the sexual intercourse, for the depth, it just benefit from the laparoscopic colon because the colon can get the long range. Because we do just not the colon graft, we do the flap of the colon that have the circulation, their own circulation for the colon. So it just have the range enough more than usually it should be more than 4 or 5 inches. Allow that one at least. So you can get their own circulation. So it's quite really strong for dilation. So that's one the benefit. But about the lubrication, it's just for the PPV, it just depends on individual. Someone have a lot, and someone do not have a lot, but someone just normal.
So is that?
So it's more circumstantial.
Yeah,
it depends. I mean, we saw the patient a lot, but we cannot definitely tell that you have. But a lot of people just have some lubricant.
Is it generally
It's very
more
good.
lubrication with colon or PPV?
In the colon, they have to do more lubricant compared to PPV. It's just, but you need to have when you have sex or you plan to have sex, you need the lubricant from
Yes.
outside anywhere.
Yeah.
Because it's just different from some people just talk for a long time ago about the colon that has a lot of lubricant fluid coming out for a long time. In the day and night time, you have to wear pad, change the pad 2 or 3 times a day, something like that. But it's not the true one. So actually, for the colon after 2 or 3 months, your body will adapt to it, and you can you just have some lubricant, but not a lot. But a lot of people do not wear pad. And you have the lubricant, but sometimes it's not enough because outside the colon still has the skin. We cannot make the colon from the just like vagina here. We cannot just make the colon to outside because it just the color is too red. But usually we try to hide the colon inside to hide the redness of the colon. Because if the colon come outside, it's just quite really visible on the redness, and a lot of people just open the leg when you see the redness. That some of the technique that we try to make the colon is good, they have to hide it after the skin. If the color of the skin is okay, but you see the color of the colon is not really okay.
I'm happy with my color and everything.
Do you have any question for the long way? What time did you come to Bangkok?
I arrived to Bangkok yesterday. I got here about 10:40 in the morning.
10:40 in the morning.
Yeah.
Yesterday, right?
Yeah.
You can see one day in Bangkok. It's first time Bangkok.
It is. Actually, it was my first time flying.
First time flying from your home, right?
It was
All right.
a big experience, that's for
Yeah.
sure.
It's good in Bangkok now because the weather is not so cold, it's not so hot, but the problem is raining a lot.
It's a long way to fly.
It was 15 hours from Toronto to Hong Kong, and then another just over 2 hours from Hong Kong to Bangkok.
I got a direct flight from England to Bangkok.
They were really good. For my first flight, I was pleasantly surprised.
I went with Thai Air.
Okay.
That was good.
I heard they were pretty good.
You arrived yesterday. I fly back tomorrow.
Yeah. I love that I got to meet you before you flew back because
Yeah, good timing.
Good timing. It's nice to meet someone that's also going through something similar to
yeah.
what I am going to be going through.
Very similar.
Yes. Ease some of the nerves, ask all the questions that I've been dying to ask, and have the answers.
How long this time you stay here?
About a month, yeah. So I arrived on 16th April and then straight to apartment and then straight to consultations and therapists and then went to hospital. And then, so when I was in hospital, I stayed overnight on the 16th and my surgery was on the 17th.
But you have a good results after surgery, but you can tell someone about how the PPV going. But right now it's just like the 4 weeks, right? 4 weeks after surgery.
I had my surgery on a Thursday, so tomorrow it will be 5 weeks.
So because it's laparoscopic, that's the pain not so bad.
Everything I do, dilating, the pain-wise, it gets better day by day.
And you can just start walking. For the PPV, it's something that is compared to the open for the colon, because we have just some graph of the PPV when we do the hybrid. So in the hospital, she just stay in the bed for 5 days, 6 days,
So how
5 or
long?
7 days. But for the colon, she can just walking in the
So
morning.
that's,
The day after surgery, just 2 days after surgery, a lot of people can walk.
I could have done that because I don't
Right.
like being in bed for a long
Right.
time.
So I can walk.
You can walk 2
sooner.
days after surgery, but for her, just like PPV, we just keep the patient on the bed for
Lots of surgery
for
right
5 or 6 days to keep the graft take.
I had a longer time where I couldn't move.
But outside it's just the same. But the problem is that for the colon, you can have to walk to get your bowel movement.
Yes.
Because we do cutting and do anastomosis on the colon and do surgery inside your stomach. It's good when you just can walk, make the bowel movements better compared to the PPV. Because PPV we do nothing on the colon. Just go inside to make the peritoneum to be the vagina, but we just keep everything just like the colon stay the same. So for the colon, it's just can just walk.
I was gonna say I'm happy that I got to walk
Yeah.
right after.
As soon as I left the hospital, and then later, and then when the catheter got removed, and I was very happy. I felt more freedom. From leaving the hospital, I felt a lot happier.
Because stay in bed long time instead in the room for the
Yeah.
long time. Because sometimes the hospital anywhere is boring compared to outside,
Yeah.
compared to the hotel. It's just
Just
actually we
the
try to
same
get
four walls.
Hard,
I just had a TV to keep me company
all right.
a lot of the time.
Actually, you just keep the patient stay in the hospital. Some clinic just you can just go back, but actually we try to just keep the patient to repack, taking the packing out. We just stay in hospital. For some clinic or some doctor can just put the patient to the hotel. But actually, we say in hotel something that's different from the hospital is the nursing care. That if you stay in hospital, you have someone you need, you can help. But when you stay in hotel, you just stay by yourself. But you need something, you have to come back to hospital. It's a different one. But in our system, we just keep the patient in the hospital until we unpack it.
I go for my surgery on Sunday, so I get a couple days to kind of explore and walk around freely, no injuries or anything.
Actually, it's quite safe to walk in downtown in Bangkok. You can go to the boat cruise. The Chao Phraya cruise is quite cheap now because
Yeah.
landing because landing is quite the price cheaper. And the night time is in Bangkok is compared to many countries. Never have time to party, but because the operation is usually it's quite a long time operation. So actually we spend a lot of time in the OR, in operating room. Not enough time for party, but I party.
You work hard, you gotta party hard, right?
Exactly.
For the PPV and colon right now is the same technique that you see when you see the belly button. A long time
Oh,
ago,
yeah.
when do laparoscopic, we just make incision under the belly button.
Okay.
For a long time, 10 years ago, that one for the technique about laparoscopic for cholecystectomy or many other surgery. But right now, a lot of surgeons want to do the incision just in the belly button.
The
So
method has
it's just-
improved.
It's improved on the aesthetic result, and you can see the sky is quite hidden in the inside the belly button. but that one is right now is the same compared to 20 years ago that we started
It
to do
used to be different.
laparoscopic in just for the after surgery for laparoscopic. For the technique that's improved a little bit on that one. But so the scar, something like that is quite okay.
I feel like I'm pretty prepared now for my
Right.
surgery. All
Right.
my questions are answered, and I greatly appreciate that.
Lots of good information.
Lots of good information.
So actually in Canada they have a lot of patients for circumcision.
Pardon?
The aboriginal children go for circumcision when they're young.
A lot of,
Just like in USA, right?
yeah.
Because the country that have something like that one, just like USA, and I don't know about Canada. Canada may be the same, right? And not in Europe. Europe, a lot of child do not have circumcision.
No.
But in Korea too, Korea in USA is the same. But the problem is that when you have the circumcision, they don't have the skin enough to make the labia enough for them to adapt a little bit. In our edition, we call edition 23 to make the edition 14 and 15 to make the labia long enough. But we just steal the tissue from the scrotum to make the labia long. A long time ago, we just made it really short, like that one. If you have just the PPV or you have the penile skin, something like very short, we just make it very short of labia minora.
Okay.
So right now we try to adapt something that to make the aesthetic result better by just steal per part of the scrotum to make the labia minora.
So a little bit of a hybrid method, kind of.
Yes, we have to develop that one for a long time, more than right now to be 10 years already, and we just there's something that you can use. I think is the only tissue that you can use from scrotum to make the labia longer. Because a long time ago, we just use the very short labia. That is not so good. We have some patient for that one for a long time, and we just thinking about how to improve that one. But right now, it's just quite stable on the technique. But we have to accept that it's not very long, but it's longer and have better aesthetic result compared to just use your own PPVs and your own penile skin. Alright, that's something that we plan to do in your case.
Yeah.
How long until my remaining stitches disappear?
It will be 2 months, 2
2
more
months.
Inside, you mean inside, right? Or
Yeah,
outside?
because all the stitches that can be removed has been removed.
That all the stitches have been removed, but dissolving stitch inside is just use they have so many absorbing stitches. They have many material for that one. We just kindly try to make proper material for each position of the labia. But actually, we use so many type of the stitches, so many type of the suture material to make different parts. So actually, we select a lot before we go into this one. So there are some stitches absorb really fast, some stitches absorb not so fast, some stitches just absorb like 4 months. But actually, some very important for you, just like the main stitches that inside your body, it takes about 3 months.
Okay.
3 months you feel nothing, just soft. But actually, because we start the stitch absorb really fast, the wound is not so good.